What is liver disease and what is the liver? What is liver disease? Liver disease, also known as hepatic, i.e. relating to the liver, disease, is a comprehensive term that refers to any condition that causes damage to the liver and prevents the organ from functioning effectively and performing its designated roles. Normally, more than 3/4 of the liver tissue is affected before the decrease of the liver functioning occurs. What is the liver? The liver is a vital organ located in the upper right-hand side of the abdomen. It is as large as a football, weighs 2 to 3 pounds, and performs numerous functions for the body, including metabolizing and detoxifying substances that would otherwise be harmful to the body, converting nutrients derived from food into essential blood components, regulating blood clotting, producing proteins and enzymes, maintaining hormone balances, storing some vitamins, making factors that help the immune system fight infection, removing bacteria from the blood, making bile, which is essential for digestion. Bile is a fluid containing water, bile acids. These are made from the cholesterol that is stored in the liver, and chemicals, amongst other substances. The gallbladder stores bile when food enters the small intestine, more specifically the duodenum, and bile is then secreted into the small intestine, which helps the food to be digested. The most common types of liver disease? 1. Infection. Viruses and parasites can infect the liver, which results in the reduction of liver function as a result of the inflammation caused by the infection. The viruses causing damage to the liver can spread through semen, blood, contaminated water or food, or coming into close contact with an infected person. Hepatitis viruses, which cause inflammation of the liver, are the most common form of liver infections. These infections include 1.1. Hepatitis A. This infection is a result of the hepatitis A virus. Patients usually contract this infection through the consumption of contaminated food and drinks. The items are often contaminated by an infected person's feces. This infection is common in places where there is poor sanitation and hygiene practice. The virus infects the liver and causes symptoms that are flu-like as well as jaundice, often evident by the yellowing of the skin and whites of the eyes. 1.2. Hepatitis B. This infection is a result of the hepatitis B virus and is spread within the infected person's blood. This infection is commonly seen worldwide, usually spreading from an infected woman to her baby in the womb, in utero transmission, through the sharing of needles, sexual contact, or accidentally coming into contact with infected blood. The virus is transmitted via blood, saliva, semen, and other bodily fluids. The symptoms are typically the yellowing of the person's eyes, dark urine, and abdominal pain. Most cases disappear on their own, whereas the more severe cases can result in liver tissue scarring and may even require a liver transplant. 1.3. Hepatitis C. This infection is a result of the hepatitis C virus and is spread through contact with contaminated blood. The majority of patients do not have any symptoms. If symptoms do develop, they may include nausea, fatigue, loss of appetite, and jaundice. 1.4. Hepatitis D. Hepatitis D is a virus that requires concomitant infection with hepatitis B to survive and is spread via body fluid exposure, needles from drug abusers, contaminated blood, and sexual contact. 1.5. Hepatitis E. Hepatitis E is a virus that is spread via exposure to contaminated food and water. 2. Immune system problems. Your immune system fights off invaders including bacteria and viruses. But it might go wrong and attack one or more parts of your body, such as your liver. 2.1. Autoimmune hepatitis. Autoimmune hepatitis inflames your liver. It can lead to other disorders and even liver failure. It strikes girls and women more often than boys or men. 2.2. Primary biliary cholangitis. Primary biliary cholangitis attacks tiny tubes in your liver called bile ducts. They carry bile, a chemical that helps you digest food. When the ducts are injured, the bile backs up inside your liver and scars it. Women come down with this more often than men. 2.3. Primary sclerosing cholangitis. Primary sclerosing cholangitis scars your bile ducts, and it can eventually block them. The bile builds up inside your liver, and that makes it harder for your liver to work. It may lead to liver cancer, and you might someday need a liver transplant. Men are more likely than women to get it. 3. Cancer and tumors. If cancer shows up in your liver, that's most likely because it has spread from another part of your body, like your lungs, colon, or breasts. But a few cancers can start in the liver. 3.1. Liver cancer. Liver cancer affects women more often than men, and African Americans more often than whites. Your doctor might call it hepatocellular carcinoma. It's more likely if you have hepatitis or drink too much. 3.2. Bile duct cancer. Bile duct cancer strikes the tubes that run from your liver to your small intestine to carry bile, a fluid that helps you digest food. This kind of cancer mainly affects people over age 50, but it's uncommon. 3.3. Liver cell adenoma. Liver cell adenoma is a tumor that doesn't have cancer. It's uncommon, but women who take birth control pills for a long time are more prone than other people to develop it. There's a small chance the tumor could eventually turn into cancer. Conditions you inherit. Some inherited liver disorders only happen if they run in your family. Hemochromatosis makes your body store up too much of the iron from your food. The extra iron builds up in your liver, heart, or other organs. It can lead to life-threatening conditions such as liver diseases, heart disease, or diabetes. Hyperoxaluria hits when your urine has too much of a chemical called oxalate. In this condition, your liver makes too little much oxalate due to a genetic mutation. This can cause kidney stones and kidney failure. If your kidneys do fail, that can give you oxalosis, where the oxalate collects in other organs and causes more trouble. Wilson's disease makes copper build up in your liver and other organs. Its first symptoms usually show up when you're between the ages of 6 and 35, most often in your teens. It not only affects your liver, but it can cause nerve and psychiatric problems. Alpha-1 antitrypsin deficiency involves a chemical that helps your lungs resist infections. Your liver makes it. But when your liver gets the recipe wrong, the faulty chemical can build up and cause liver disease. Other causes of liver disease. Alcohol abuse can lead to cirrhosis. So can non-alcoholic fatty liver disease and long-term cases of hepatitis B and C drug overdoses. Taking too much acetaminophen or other medications can harm your liver. Make sure you follow the dosing instructions on the label, and be aware that acetaminophen might be in more than one medicine you take. Non-alcoholic fatty liver disease, NAFLD, is when too much fat has built up inside your liver. The extra fat can inflame your liver. One type of NAFLD is non-alcoholic steatohepatitis, NASH. It means you have inflammation and cell damage in your liver, as well as fat. It can scar your liver and lead to other disorders, like cirrhosis. Complications of other liver diseases, especially those that aren't treated, may contribute to the development of liver cancer. Acute liver failure. This happens when you don't have a long-term liver disease but your liver quits working within a very short time, days or weeks. That may happen because of an overdose of acetaminophen, infections, or because of prescription drugs. Cirrhosis is a buildup of scars in your liver. The more scars replace the healthy parts of your liver, the harder it is for your liver to do its job. Over time, it may not work like it should. There are many different types of liver disease, but with any liver disease the liver damage will progress in a similar way. It is important to know what happens to your liver at each stage of the progression before complete liver failure. Understanding the progression of liver disease may help you make better health choices. Your liver is one of the most important organs in your body. When your liver cannot function properly, your whole body will be affected. Here are the 4 stages of liver disease. Stage 1. The first sign of liver damage is inflammation. One of the main functions of your liver is to detoxify your blood of toxins found in the food you eat and the products you use. Inflammation in the liver is a sign of your immune system responding to foreign substances, such as too much toxins. This can cause your liver to enlarge. There are many causes for inflammation. Excess fat in the liver, too much toxins, or a viral infection in the liver can make your liver tender and swell up. These are some conditions that might cause inflammation in the liver: non-alcoholic fatty liver, alcoholic fatty liver, and liver hepatitis, including viral hepatitis or autoimmune hepatitis. Most of the time, you can feel if your liver is injured when you have stomach pain in the liver area, the upper right area of your abdomen. Sometimes, you will feel heat in the area. There are some cases where you have no sign of inflammation at all, such as in non-alcoholic fatty liver. Let your doctor know if you have any signs of inflammation. Treating your liver at this stage can help reverse liver damage. Stage 2. Fibrosis is the start of liver scarring. When you do not treat the inflammation will start to cause the liver to scar. These scar tissues will replace the healthy liver tissue and thus reduce liver function. This entire process is called fibrosis. When the liver's function drops, toxins and fat will continue their buildup in the liver. Besides preventing the liver from functioning, the scar can block blood flow to the organ. At this stage, there is still chance to save your liver through medication and lifestyle management. Your liver has an amazing healing ability, thus it still may heal from this stage. Stage 3. More severe scarring leads to cirrhosis. If you don't treat fibrosis, you are at risk of the next stage called cirrhosis, which is severe scarring of the liver. At this point, the liver can no longer heal itself. It can take a long time to develop cirrhosis, sometimes 20 to 30 years. Unfortunately, this is when people start noticing liver disease because the symptoms are more obvious. Cirrhosis can lead to many complications. Some of the symptoms and complications are fatigue, or feeling tired, weakness, itching, loss of appetite, weight loss, nausea, bloating of the abdomen from ascites, which is a buildup of fluid in the abdomen, edema, swelling due to a buildup of fluid in the feet, ankles, or legs, spider-like blood vessels, called spider angiomas, on the skin, and jaundice, a condition that causes the skin and whites of the eyes to turn yellow. Cirrhosis can lead to a number of complications, including liver cancer. The treatment for cirrhosis is to control the progress of the scarring and treat any complications and symptoms caused by cirrhosis. Stage 4. Liver failure. Your liver has lost all ability to function and unable to heal. Liver failure can be a chronic or acute condition. Acute liver failure strikes fast just in 48 hours as a reaction to poison or a drug overdose. While chronic liver failure developed from cirrhosis may have been going on for years. When you have liver failure, your best option might be a liver transplant. As liver failure gets worse, it can affect you mentally and physically. You may feel confused and disoriented. You may experience diarrhea, loss of appetite, and lose weight rapidly. Because these symptoms can be caused by many other conditions, it is hard to diagnose liver failure just from a physical exam. When you get the diagnosis for liver failure, you will immediately get medical attention to salvage what is left of your liver. If this is not possible, the only option may be a liver transplant. It is important to have your health checked regularly, as liver disease can be detected during the inflammation stage or fibrosis stages through an ultrasound or X-ray of your stomach. If you are treated successfully at these stages, your liver may have a chance to heal itself and recover.